All right. Welcome, everyone. I appreciate you being here with me. If you're in California, it's mid-afternoon, and so I appreciate your time and being here today. The title of today's session is Data Equity in Justice Diversion. My name is Danny Soto. I'm from an organization called Impact Justice, and I'm one of the CARE Crisis and Recovery Enhancement TA Center partner organizations. I'm going to be presenting and I'll be your moderator as well. So bear with me as you will be hearing a lot of my voice today. I wanted to kind of start with a few logistical things before we jump into the presentation. So first of all, thank you again, everyone, for being here. We did want to invite folks to use the chat box for any questions that you might have. Samantha Tiscareño, my colleague, is going to be helping me man the chat. And so I'll be pausing periodically throughout my presentation to see if there are any questions so far. And then we will definitely have time at the end for more Q&A and discussion and that kind of thing. So please put your questions in the chat. We also warmly invite you to participate throughout the presentation by using your Zoom emoticons at the bottom of your screen, the heart, the clapping, the thumbs up, and that kind of thing if you are so interested. Also a reminder that everyone's microphones are off and the session is being recorded. And the PowerPoint and handouts will be available after the presentation through the conference website. So when you log in and you see all of the sessions you've signed up for and that kind of thing, you should see tabs for this session and any others with the materials posted. All right. We will also at the end be posting a feedback survey, and we really appreciate you giving us your feedback. It only takes a moment or two to fill it out, and so that will be coming at the end as well. And so first, just some logistics. So the first is a disclaimer slide. This training is offered through the Crisis and Recovery Enhancement TA Center, which is funded by the California Department of Health Care Services and administered by the Center for Applied Research Solutions, or CARES. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the California Department of Health Care Services. In the unlikely case that there are any security issues that may occur, this session will immediately end and will not resume. A separate email will be sent to all participants with further instruction. Thank you. This slide is just some need to knows and some community agreements. Please, again, you are more than welcome to use the chat box. We invite you to use I statements in the chat and avoid making comments that are stigmatizing or otherwise injurious towards others. Your message will be received by our chat box monitor, Samantha, who will filter all comments as able. The chat box monitor will not share comments to the audience that are harmful. If you experience any tech challenges, we have a CVent tech host with us today, Marcus. And so please place a message in the chat box to Marcus if you have any issues at all. Please follow the community agreements and reach out for support if needed by contacting a support line. If you need to step away from this session and would like to go to a quiet place within the conference for self-guided grounding, please exit from this session and go to the exhibitor booth entitled Calm Space. All right. And so with that, we can jump into the presentation. I'll do learning objectives, and then I will do a brief introduction of myself as well. So learning objectives, hopefully at the end of this session, participants will gain an understanding of what data equity is. Second, participants will understand what data equity looks like throughout the main phases of a project. And participants will understand, or at least hopefully have some ideas of how to apply data equity to their own work. All right, so data equity, theory and practice. I'll take a moment just to introduce myself a little bit. So I'm Danny Soto. I work at Impact Justice. I am the Associate Director of the Research and Action Center. And so we have many projects at Impact Justice, but I'm on the research arm in the Research and Action Center team. I've been a researcher focused on mostly juvenile justice issues since my undergrad. I got my PhD in sociology, criminology, and focused on juvenile delinquency, race and ethnicity, and gender sexuality. I also was a professor for 4 years after grad school, and really found myself wanting to do more applied research. I came into this field driven by a personal desire to pursue what I feel is true, fair, and just systems of justice. I grew up the daughter of an undocumented immigrant in a mostly white rural town. And so, my early experiences watching my dad be harassed by police and seeing some of my cousins kind of bounce in and out of the system as they were growing up really kind of drove me to this work. And so with regards to research, I really wanted to do more applied research, which brought me to Impact Justice, eventually. And so I transitioned to the nonprofit arena. And so I'm a researcher. I see my role as a researcher as a supportive one. I absolutely see my role as to support the frontline workers who have the expertise in their communities and their populations. And so, this topic in particular is near and dear to my heart. I nerd out about this stuff a little bit, but data equity is really, really important. I think whether you're doing research or quality assurance or even just running a program, data-driven decision-making has become, something of a buzzword, but I do think that it's really important and an important step in addressing inequality and inequities in our systems. All right. So I will go ahead and jump in. So data equity. What is data equity? Data equity, this is my kind of definition here, is a consideration through an equity lens of the ways in which data are collected, analyzed, interpreted, and distributed. So each of those kind of points, we want to be using an equity lens, right? Asking who is included in this data, who might be left out at every single step of the way. And one thing I just want to acknowledge here, and this is difficult for everybody, we never reach a point of perfection, pursuing equity is a journey, and hopefully we're all making progress. But one of the things that's difficult to kind of hold as we move along is it's really easy to count the people we see, that we see both visually and indirectly on paper. But it can be really hard to think through who's not included. But that's the missing piece that can help us, get further and closer to the true equity that we're working toward, is thinking through who's not at the table, who are we not seeing, who's not included in this process. And so, data equity really should be informing every step of a project, from project design. So thinking through what the project goals are, who's going to staff it, how are we going to reach the people we're trying to serve, what does the program look like, what is it structured like, where does it take place, how do we increase access, all of those things that go into project design. We should be holding an equity lens. And with data equity, we're talking specifically about the information that we're gathering along the way, whether that is in a database, on a spreadsheet, in an email, part of a conversation, interviews, that kind of thing. A lot of times when we talk about data, we think only about numbers, but data is just a jargon term for information. So if you think about all the ways that you gather information, that's what I'm talking about when I talk about data, is both qualitative and quantitative, all forms of data. Also, obviously, data collection, the ways that we gather data, the ways that they are accessible or not accessible to folks in the community and that kind of thing. And each of these we'll be breaking down and going in more depth into. Data analysis. How do we make sense of the numbers that we have or the information that we have? How do we go from a spreadsheet or a transcript of an interview to actionable findings? And part of that is also the interpretation of our analysis. What kinds of conclusions are we drawing? What kinds of implications are we making? What kind of recommendations and that kind of thing? And then, the research doesn't stop just because we've reached, our conclusions. There's also that piece at the end and thinking through sharing and benefit. Who are we sharing our information with? And who is it benefiting? And how is it benefiting the communities that we're trying to serve and reach? So data equity should be a line running through all of these steps of the process. So let's go through and dive a little deeper into project design. So hopefully our project goals have already been constructed with an equity lens. That is the hope. Sometimes we inherit programs, we inherit plans, and we inherit goals and that kind of thing. That's very common, especially in nonprofit work. And so if it is the case that you weren't able to be part of the goal setting process and you kind of inherited them, that's a good opportunity, or that's a good time to look for opportunities to revisit, to clarify, and to revise if need be, to make sure that the goals are constructed with an equity lens. During the project design, we should be thinking through and discussing. And when I'm saying discussing, right, there's an implication that there's more than just you at the table, right? And so paying attention to who's in those discussions is also an important part of equity. What stakeholder groups, how are we getting community input? How are we getting client feedback? All of that stuff. So we should be thinking through and discussing to what extent were or are impacted communities included in goal development. If they were not involved, we should assume that we have some blind spots, okay? And that's not to say that we have to scrap it and start over. Sometimes that's just not realistic. Ideally, we would be constructing perfect programs, perfectly equitable programs from the get-go. But if we're inheriting things that weren't necessarily constructed with an equity lens, it's an important note, right? It's an important note to make or it's an important assumption to make that we probably have some blind spots. And so then be on the lookout for where those blind spots are and where there might be opportunities to revisit and revise and clarify, okay? We need to be thinking through and discussing what do we need to measure in order to see progress toward our goals, toward whatever those goals are, right? To in this context, I'm kind of talking about justice diversion. So, how are we going to measure if we are successfully diverting people away from the justice system? What do I need to measure to see if anyone is being left out, or to make sure that program impact is equitable, right? Also thinking through what kind of baseline or comparison data do I need, right? Do we want to go back to last year or the past 3 years and see how many folks with serious mental illness ended up in the justice system, right? So we can have a baseline of, okay, this many people, we want to reduce the number of people, right? But you need to have some kind of baseline information or some kind of comparison data to know if we're making progress. Another aspect of project design is thinking through what groups should we be paying attention to, right? Sometimes these groups are already articulated in our goal, right? Our goal is to provide, sober living housing or, no strings attached housing to homeless, formerly incarcerated women and their families, right? So sometimes the goals will spell out the groups that we should be paying attention to. But really, we should also be thinking broadly, right? about and thinking through if any group that's been marginalized that's relevant to our goal, right? So if the intention is to serve, homeless women and their families, and or homeless formerly incarcerated women and their families, I'm going to say right off the bat, not only do we need gender, right, information, but we're also going to need racial and ethnic information, right? Because we know that most folks who are justice involved are racial and ethnic minorities, right? Black, brown, BIPOC folks. Thinking through, those who are not heterosexual cisgender men, basically, right? Is that a population that's relevant? Immigrants, children and the elderly, those with disabilities, those without stable housing, right? These are all groups, and there's more than that, right? But these are just some examples of groups that have been historically marginalized. These are also the groups that are typically least studied, right? Least, we have the least amount of information on them as well. Now, thinking very broadly, it can be overwhelming, right? Thinking through what groups we need to really pay attention to. It is okay to prioritize. It's okay to prioritize. However, you want to make sure that you're making those decisions very deliberately, very carefully, and including impacted communities in those conversations as much as possible, because they will be able to help you prioritize appropriately. Okay, otherwise we have to assume that we have some blind spots. Another important thing to think through is how success is being measured. System and funder priorities may not always align with how community members would define success. I'll give you one example, right? In the justice field, we're almost always looking at recidivism, the likelihood that someone will quote unquote reoffend or have further contact with the justice system or that kind of thing. That is almost always an outcome that we have to report on. However, that is not, in my view, the best measure of success by any means, right? The best measure of success is thinking through, how is anyone better off? And if so, how? Right? Has the program actually increased well-being? Has the program actually delivered services and resources that it's setting out to do, right? So I want to encourage us to think, obviously we have obligations that we need to meet with funders and with systems and that kind of thing, but I encourage us to think beyond just those often inadequate measures of success. And then throughout this process, we need to be aware of our unconscious and conscious biases. We all have them. And so it's not a matter of, trying to make excuses or anything like that. We all have them. And our responsibility is to try to be aware of them and be aware of the implications of them in our decision-making. In terms of data collection, I think the most obvious thing here is collecting the right demographics, the right demographic information that's going to let you make sure that you're reaching your target population, and also, making sure that there's not inequities in program success or program access or anything, right? So we want to make sure that if it's a program that's aimed broadly, that that it's serving men and women and others equally. Same thing with racial ethnic groups. We want to make sure that the impact is similar, across groups. And so for race and ethnicity, this is the, almost across the board, the first thing people think of. It's important to make sure that you're using categories that make sense for your community, right? So an example of this is I grew up in Montana. And in Montana, there's not a lot of racial and ethnic diversity. That might not be a shocker to many of you. And so broad racial categories like Asian might make sense in a context like Montana, where there's not a large Asian population, there's not a lot of racial ethnic diversity. In fact, most of the disparities we see in Montana are around discrimination and inequities for Native Americans and Indigenous folks. However, here in the Bay Area, when we're putting together surveys, we break down the Asian, the overarching umbrella kind of Asian category. We break that down. East Asian, Pacific Islander, South Asian, we break it down because those categories have different meanings in our community here in the Bay Area. So make sure that you're using categories that make sense for your community. Don't be afraid to go beyond kind of the standard census boxes that we're probably all familiar with. Similarly with SOGI data, this is sexual orientation, gender identity, and expression data. You know, use the categories that make sense for your community and be thinking through what kind of demographic information you can gather in that area. And then of course, any other measures based on the equity priorities that you've identified in your project design. Make sure that the goals, the measures, everything kind of carries through into your data collection. And then thinking through data collection tools, right? So there's language, and I mean language in two different ways here. One is the actual language, the written and spoken language, right? Making sure that any data collection tools, whether they're interview protocols or surveys or forms, are translated into the languages that your communities are using. And then the second piece of that language is also the wording, right? So my director gives this example a lot, was when they were doing some kind of survey, she was doing some kind of survey around housing. People found "where do you live" as kind of confusing, because people might live at one place, but they might stay in another place. And what the survey was trying to get at was really, where do you stay, right? Who comprises your, you know, day-to-day household? And so thinking through wording that is appropriate and that makes sense to your target population, I think is really important. And so with that input, again, from community members, and or if you're lucky enough to have staff with lived experience, that input is invaluable. If that is not an option for you, at least consider piloting. Pilot your instrument, whether that's a survey or interview protocol or anything, pilot it and debrief and you know, see if there are any tweaks that need to be made, if anything seemed to be confusing and that kind of thing. And again, how do you measure success? Thinking through what you know, if our goal is to increase well-being, how are you going to measure well-being, right? That is a broad category that can be taken in multiple directions. And so thinking through what is relevant for your program. Another thing with data collection, and again, this kind of goes back to the goal development and project development. If you are inheriting data, and we almost always are, right? Unless it's a brand new organization or a brand new office, you know, we're inheriting data. I want us all to assume that it's biased until we know that it's not, okay? And basically what this means is just, I want us to go in ready to ask questions about how the data was collected, how were the questions asked, what were the response categories, and thinking through what is missing and who is missing, right? And so sometimes we'll call that like a data biography, right? Like, what's the history? Here's a little data point. What's the history of how we got there? And thinking through, you know, where might there have been, you know, intended or unintended bias kind of built in. Also thinking through, do you need data from other partner organizations, other system departments, or other community-based organization partner data? Oftentimes we will need, if we're going to be doing an evaluation, we might need information from referral sources, right? A question might be, are referrals being made equitably, right? A lot of times we can only deal with the people who are referred to us, but we want to make sure, if at all possible, that those referrals are also being made equitably, so that they're not only referring men or low-level offenders, or, you know, whatever the case may be. Do you need information from the criminal legal system? If we're doing a justice diversion project, then we most likely do, right? We want to make sure that we're not net widening. We also want to make sure, we also want to keep our eye on racial and ethnic disparities, right? Racial and ethnic disparities exist at every single point of the justice system, both adult and juvenile. That is an established fact. And so we want to keep our eyes on those disparities and see, are they persisting or are they being reduced, right? One of the goals of diversion is to get people away from the justice system with the ultimate goal of reducing some of that, the disparity that we see in the system. Before I move to data analysis, I want to check in with Sam and see if there are any questions so far.
No questions so far, but anyone, feel free to go ahead and leave them in the chat, and then at the next question break, then I will let Danny know whether it's relevant towards a specific slide, or you can wait to the end and hopefully we can open up your guys' mics and you guys can just ask them directly.
Perfect. Thanks, Samantha. All right. Also, feel free to let Sam know if I'm going too fast or anything like that. She can let me know to slow down if need be. Okay. So when it comes to data analysis, and I say this as a researcher, I say this as someone with, I got a minor in statistics at the PhD level. I'm, a numbers freak. However, even if we're dealing with numbers, data analysis is not purely objective. It is not. We all carry with us our own experiences, our own assumptions, our own biases, and those affect our decisions, okay? And data analysis is not just some kind of technical, magical thing that happens. It is a series of decisions, okay? And they're not necessarily free from bias, okay? That doesn't mean that if I make a different decision than someone else would have made, it doesn't necessarily mean that their decision is incorrect. However, if we are using an equity lens throughout, it will result in analysis that is more right. And I put that in quotations because it's kind of awkward wording, but I didn't know how else to express it. But I will always believe that doing data analysis with an equity lens is better and is more right than something that might be technically correct, but doesn't include that lens. Another thing to keep in mind when it comes to data analysis is to think through how to explain your methods in layman's terms. Some of us might be professional researchers, we might be the data folks on our team or in our organizations. Some of us might be laymen when it comes to research, but we always want to be able to explain the decisions that we made and what we did with the data in very easy to understand terms. So data analysis should be accessible and transparent, meaning, I'm not going to use big fancy jargon words to try to confuse people about what I did, or to try to make people feel like, oh, well, whatever Danny did was so complicated, I couldn't ever really wrap my head around it, right? I kind of approach this as building capacity around data literacy. So to the extent that we can use these opportunities as kind of like teaching learning moments where we're walking people through and being very transparent about how we approach the data analysis. This is very similar to doing the data analysis, but pulling together findings is really part of the, another thing my director always says is, research is art and science. And I think the analysis is more of the science piece, and the interpretation of findings, I think, needs to include a little bit of that art to make sure that we are providing the right context, the right background, and we're reaching the right conclusions. So the interpretation of findings is also not objective. It's absolutely informed by our worldviews, by our assumptions, our experiences, and of course, our biases, whether we're aware of them or not. One way to kind of help this is to make sure that key stakeholders are a part of this discussion. Again, those from impacted communities can help interpret, often with more complete contextual and background knowledge, what we're looking at and putting the findings in the proper context. The expertise of lived experience is invaluable here. It's really important for us to be especially self-reflective at this stage, because this is one of the last stages of the actual research process, is interpreting your findings. So we need to be really self-reflective about what assumptions am I making about causality? And by causality, I mean, A causes B. So what assumptions am I making about what causes poverty or what the consequences of poverty are, versus looking at systemic issues that cause and perpetuate poverty, right? So what assumptions am I making about what causes what, and what is the consequences of what? And what assumptions am I making about what success looks like? Again, if my definition of success does not align with the community's definition of success, it's gonna be a little bit crossed wires there, right? Okay. So I want to go back to this stakeholders, making sure stakeholders are part of the discussion, because there's a couple different ways you can do this, right? Sometimes for some research projects that are very large, we might actually set up an advisory board where, we might have key stakeholders, maybe somebody who's like an expert in the relevant field, and also folks from impacted communities. And they're the ones that we kind of touch base with over the course of the project, right? If you have some kind of committee that the project is operating under, think about ways that you might be able to incorporate community participation on those committees or in those meetings, and things like that. So sometimes it looks like a formal advisory board. Sometimes it might look more like a town hall, where it's like you put up some flyers and hope people, will come. There's also different ways to do outreach within the community, leveraging those community-based organization partners, faith leaders, community centers, and things like that, when you're getting ready to interpret your findings and sharing your findings. And so, how to share and use findings. So be thinking through, who are you going to share findings with? Who is your target audience and why, and who might be excluded? Most of us are probably familiar with, on some level, preparing reports for funders, right? However, although I'm very grateful for all of the funders who are funding your amazing work, as well as my organization. I work at a nonprofit. So I'm very grateful for the funders, but they aren't the only or even the most important audience, especially when we are working with really marginalized communities. The impacted community should absolutely be one of our target audiences. And thinking through what this looks like, how do we do this? How do we get engagement? That's something I would love to talk more about with you. And so I welcome questions and discussions at the end as well. But I want us to think a little bit more broadly about who the audience is. Also thinking about our peers. So other practitioners, other service providers in the field might be able to benefit from what we found works and what doesn't. And then thinking through not only who you're going to share the findings with, but how are you going to share and communicate findings, right? So that we could do a social media campaign. Who has access to those formats and platforms? We might think we're going to do, a conference presentation. Who has access to those platforms and formats? That's not to say that we shouldn't do those things. We're all at a conference right now, right? Samantha is helping on a social media outreach for one of our other research projects. But the question, if we want to use a data equity lens to approach this question, again, we have to ask ourselves, who might be excluded? Who might not have access? Is there a way that we can maybe touch multiple platforms and multiple formats to ensure that we're communicating to the right audiences? Also think about different forms of communication. Written word isn't the only way. Again, often funders require a written report. And so that tends to be the default. That's full disclosure, that's my default as well. I know how to write a report, right? But the written word isn't the only way. There are ways to do videos. There are ways to do virtual data walks. There are ways to incorporate art and more kind of, beyond my scope of creativity, but there are other forms of communication besides the written word. And so, yeah, just thinking about access and who might be excluded. Another kind of big picture question is, how are you going to fit your findings into a bigger picture? And what is that bigger picture, right? A lot of times, and this is, we have full plates. We're always kind of, looking to the next project, to the next program. But when and where we can, I think it's really important to take a step back and think holistically about the direction that the findings are implying and what might be missing there. So what background or context are you providing? If you're not providing the proper context or background, people tend to fill in with their own stereotypical knowledge. Okay, not everyone is an expert. Not everyone has knowledge of the communities that you're talking about or the community that you're talking about. So I think it's really important to provide the proper context and background. Otherwise, people tend to kind of fill in the gaps themselves, which may not be accurate. To what extent is this information biased? Is the language that we're using people-centered? Is it humanizing? Is it strength-based? Are we tending to use absolute terms by implying that such and such a choice or such and such a decision, inevitably leads to X, Y, Z? The language that we use prompts us to draw conclusions. Even if we're not stating the conclusion, it prompts people to draw conclusions, right? And what conclusions will readers draw? That's a very important thing to consider. What arguments or persuasions are we using? All research is persuasive. All research is persuasive. We're trying to persuade folks that our findings are correct, we're trying to persuade folks that our recommendations are sound, that our findings are sound. And so we just need to operate under that knowledge and be aware of what arguments we're making. Well, maybe I will pause there and see if there's anything else that's come up in the chat. Samantha?
No questions.
Okay, great. All right. We are almost done here. So just a few kind of thoughts in closing is there's no such thing as neutral or purely objective research. The important thing is that we are aware of our biases, that we are aware of our positionality. That's a jargony term, but basically being aware that all the intersections of my identities, which I love and I'm so proud of, really mean that I don't have the experience or the perspective of someone else. It's impossible, right? So naming and being aware of my own positionality, how that might relate to, people around me is really important. If research is presented as neutral or objective, or if it appears so, it's probably just biased toward the mainstream and likely excludes people and knowledge at the margins. One thing I want to emphasize is when we're excluding people from the table, from developing goals, from helping us to interpret our findings and that kind of thing, when we're excluding people, especially when we're talking about, folks from impacted communities, we're also excluding their knowledge. We're also excluding their lived experience and their expertise. And so it's really important to be aware of that. And the reason I say that, if things appear neutral or objective, it just means it's biased towards the mainstream. It's because if we're not talking about the marginalized group, the default is the mainstream group, right? When we're talking about people's experiences, we're usually talking about, men, right? Unless we're talking about women, then we're talking about women. And this comes up a lot in the justice system, right? When we're thinking about reentry, when we're thinking about arrest, when we're thinking about incarceration, we almost always think about men. And men do actually comprise the bulk of the folks who are system impacted and system involved, right? That's a fact. However, bringing that data, the equity lens period, forces us to really talk about, folks who've been marginalized. So if I'm reading a report about a prison and it's silent on gender, I assume that they're talking about men, right? Same thing when we're reading research, generally, and it's silent on race, right? It's usually just kind of inadvertently focusing on the experiences of white folks, right? So we want to be really, really aware of who is excluded and how we're talking about our research. And then finally, in closing, doing research with an equity lens helps us make better decisions and do better research. And every time we collect data, we're adding to our collective knowledge. That's something that's super exciting to me, is that this idea that like every time we're collecting data, we're adding to our collective knowledge. And when we collect data with an equity lens, we're helping to correct some of the biases that exist in our collective knowledge. So I don't think that like research is the silver bullet here. It can't solve all of our problems, but I do strongly believe in the potential of all of us as experts and whether we're professional or kind of amateur researchers. I really believe in the power of research and data to help us improve and grow our collective knowledge. And with that, I will turn it over to any discussion or questions that anyone has. And I think at this point, Marcus, we can allow folks to unmute themselves. And so folks can unmute and ask your question, or if you're comfortable, or if not, feel free to use the chat. Any questions or comments?
Danny, I do have a question here. And so one attendee is asking, how can I ask a question? I wanted to ask how I can ethically collect demographic data when the people I work with may not want to engage with us. If I have to collect their data when I engage with them. We provide life-saving services, and we do not want data to be a barrier to receive those services since we value people's anonymity.
Totally, totally. So it is not uncommon for folks, especially from marginalized communities, folks who have had really, really bad interactions with systems in the past, to not trust the system. Whether or not we are actually representatives of the system, we can be perceived as such, right? And so the high level question I would ask is there any way or how does your organization or your team increase trust and credibility with the population that you're serving? So that's a high level, really difficult kind of question that is, a big one. On the more practical side, if we're talking about an emergency situation, obviously the person's life and their health and their safety and well-being in the moment is much more important than getting them to sign a form, right? If you're in the ER and, this is like a thing that we see like in movies and on TV, right? Like you need life-saving health service and someone wants you to fill out a form, right? We don't want to replicate that. That's very harmful. If there's an opportunity to gather data afterwards, that is an option. Or if there is the opportunity to talk, right, to speak with someone either before or after, one thing that can help is by sharing with people how their data is going to be used. and who has access to it. I'm thinking right now, I have a lot of family who is undocumented. And so asking someone about their immigration status is a huge red flag. Not all my family members will answer honestly or at all, because they are legitimately afraid of retaliation, right, or deportation. However, we know that undocumented immigrants experience a lot of disparity. And so how do you balance the need for that data with their legitimate fear, right? And so I think being very clear about how you're using this data, that your data will help us serve other people from your community, and who has access to that data. We will not share this with ICE to the extent that you could say that, right? I mean, and you want to be honest. You want to be honest. You don't want to deceive anyone. So more transparency, I think, can increase trust and credibility. But I think that's kind of the underlying issue that needs to be got at here. And so looking for opportunities either before or after the service when you can gather that information would be a best practice. Something else is, if it's a case, it's a little more difficult when it's a one-time service interaction. However, if you do have the opportunity to provide services over time, hopefully during that time you are building trust and credibility, and you can return to those questions, right? So one thing, a best practice with juveniles who are in custodial settings in the state of California, we ask them about their sexual orientation and gender identity. That is very sensitive. Kids might not feel comfortable coming out, especially during intake when they're scared and they don't know what's going on and that kind of thing. So if they don't disclose, that's a question that is returned to over time. And hopefully at some point, young people will feel comfortable to disclose. So those are a couple kind of practical things. And if you have any, I'm not sure if that kind of encompassed your question, so please feel free to add any follow-up questions in the chat or, jump on a mic. Let's see, I'm looking at the chat. The next question is, how do you approach collecting data for those that identify as Hispanic or Latinx? For federal data collection, this capture has an ethnicity, not a race. That's right. So this is a perfect example of, trying to use categories that make sense for your community, but they don't necessarily line up with the census boxes, right? So some of this, it depends on how you're going to be using the data. If you have federal reporting requirements, you're going to have to check those boxes, right? And so what I would do in those cases is, perhaps, Hispanic and Latino folks, according to the federal government, technically are white. That would mean that I would be expected to check the white box on the census, which makes no sense. Which makes no sense for my lived experience or, how I'm kind of interpreted socially. And so what we do, if we have a choice, is we use a combined race ethnicity category. So it will list, it will list all of the categories that make sense, including Latino, Hispanic, and we let people check as many boxes as apply. So that's how we do it, knowing that if we then had to turn around and report that data to the federal government, we might have to do some collapsing of data. If you have the opportunity to let your clients be a part of that conversation, you can do that. But that's what I would do is, I know that federal data has ethnicity and race separately, but we use a combined race ethnicity and just include all of the categories that make sense and let people choose multiple categories. Sometimes this does complicate reporting, but I think I would rather err on the side of letting people identify. This is also a point of cultural sensitivity, cultural responsivity. If people don't see themselves identified on your intake forms or your referral forms, that's going to be a little off-putting, right? That's going to be like, okay, they don't really understand me. They don't really understand my community. And so if it's within your power, I would say just use to combine race, ethnicity, and list out whatever makes sense for you. And again, if any of these questions, if I'm not fully addressing them, please put follow-ups. Ale notes that they've used biannual participant satisfaction surveys with an optional demographics section in order to get demographics. Yep. So that's another way if you're not able to gather data in the moment, doing, every so many months or annually doing satisfaction surveys can be a way to at least get a chunk of that data. And then, right. S. Tieran, I'm not sure if I'm saying that correctly, states that I feel I lose trust when I ask their race afterwards because they repeat that they are Hispanic or Latinx. I'm unsure how to record those race for federal data collection as it's not an unknown or refuse to answer. I do believe there is an other. I could be mistaken. In those cases where it really is out of our hands, if you have a form that you're mandated to use, I would just start with an apology. I mean, that's how I would do it. I would say, I am sorry. I have to use this form for our, report. I know that this might not make sense to you, but what would you like me to check? And just ask them. And then it gives them the power to unfortunately have to identify within these boxes that might not make sense for them, but at least it's their decision. And by previewing that, like, I know this might not make sense for you, but we have to do it, kind of aligns you with the participant in hopefully a way that is not off-putting and does build a little bit of trust, right? Like, you understand that this isn't going to make sense for them, but can you help me fill this out on your behalf, or, that kind of thing. These are great questions. Any other questions or comments? I think I got through all the ones that I'm seeing in the chat. Okay, great. Just so everyone knows, maybe this is a shameless plug, but these are the kinds of things that I really, really love kind of wrestling with and kind of problem solving and brainstorming with folks. So, feel free to reach out after the session. If there's anything that I can help with, please reach out. Impact Justice is also a partner in the CARE TA Center. So you can always, if it's something that that you would like some TA around, you're more than welcome to submit a TA request to the CARE TA Center as well. I often field the data related ones since that's kind of my bag. So yeah, thanks everybody. And so if any other questions come up, feel free to put those in, but I will go ahead and move us through the closing slides. Let me just ask really quick, Samantha, do you have the feedback form link?
Let me double check. I might have it in an email.
Okay, I actually have it right here. I'm just gonna stop.
Okay.
No, this is a little bit clunky, but I have it here. So let me I'll just copy it and put it in the chat.
Oh, Marcus got it.
Oh, he's got it. Perfect. Great.
Thank you, Marcus.
Marcus to the rescue. Okay, so we're back here. So please take a few moments to give us feedback. And there we go. So yeah, we need to hear from you to keep bringing you these free resources. So please take a few minutes to give us your feedback. And we do plan we use it to plan future learning opportunities, as well as, it helps us share our impact back to the Department of Healthcare Services as well. And we look forward to continuing to work with you. Please stay in touch. Here is the general email for the CARE TA Center. There's the website. There's all this social media handles down there. So, follow if you so desire. And with that, I believe that concludes our session. Oh, I'm sorry, we do have a few more minutes and Shelley said that she has a turn or a question. And thank you for the feedback that's coming through in the chat. I appreciate it.
Hi, is it okay to talk?
Sure.
Okay, sorry, I had to log on to my computer so I could voice it. Because
Sure,
it's
go
getting
ahead.
really long in the chat. So my question to you kind of builds on to the Hispanic question of how when I do the federal data collection, how the ethnicity part is separate from the race part. My question to you is, I believed it was that, and I've done the approach where I said, I'm so sorry, I have to ask you this, which I think is a great idea. And they have said, okay, Caucasian, white. But my second question to that is, well, now it shows that I'm serving Caucasians more than I'm serving the threshold languages that represent the community that I serve in. And so how do you approach that where it says, hey, you're helping more of this and this race, but really I'm actually reaching, more. So I'm just,
Right.
that's the part that I struggle with.
Right. So that's where it gets really complicated, right? If your funder is insisting on separating out race and ethnicity, and then only wants to talk about race, it absolutely does erase most Latinos in the United States, right? Some are white, some identify as white, but for those who are Black or brown, that erases them, right? And so there could be other ways that you might be able to indicate, for lack of a better term, minority status. You could use language used in the home. You could use immigration status if you gather that data to, make the argument like, okay, yeah, so, 80% of our clients are quote unquote white, but, they all speak Spanish at home and the most of them are immigrants. Like that kind of paints a different picture. So thinking about what other data points you can pull in to make that these aren't, kind of stereotypical white folks living here. We're serving, the Hispanic community. And then something else that I've done specifically, so with recidivism, the federal government defines recidivism technically as an arrest, any kind of rearrest. I don't think that's the best measure of recidivism because the charges could be dropped. This could be a kid that's being harassed by the police and is like being rearrested, right? So I will report that. If I'm required to report that, I report that. But in my report, I follow it up and I emphasize that, okay, so here's the number that you asked for, but here's the number that I think it's actually new sustained charge is what I would want to use for recidivism. So I'm pushing back as much as I can, where I'm fulfilling the requirements of the reporting, but I'm thinking about what other information can I bring in to point out that they're missing things here. And that's sometimes they change and sometimes they don't, but I feel at least my effort to try to get them to be aware.
No, I didn't even think about that. So I really appreciate it. Really appreciate it. So
Yeah.
Thank you. I won't take up any more time of questions.
No problem. All right. Okay, I haven't seen anything else come through in the chat. So I'll give you all 2 minutes back. Thank you, everybody. This has been the highlight of my day. So thank you. I appreciate it. Bye.